Hello, my name is Paul Lorenz. I'm the Chief Executive Officer for Santa Clara Valley Medical Center. Most people that come to Santa Clara Medical Center, the notion that we're here to serve the community is probably at the forefront of interest. That really is what healthcare is all about. Really getting down to the individual and meeting the individual's needs, irrespective of where they come from, their social economic status. I'm very proud to be part of a system that is here for the community and here for the patients. That's first priority.
I'm Oliver Su, Assistant Director of Pharmacy for Santa Clara Valley Medical Center, Hospitals and Clinics, as well as the Residency Program Director. Within the county system, we're not just a hospital, we're also an integrated health system for the entire community. Not just will you get inpatient rotations in critical care and infectious disease, but we also have numerous outpatient clinics and pharmacies for residents to get involved in. We have a heart failure pharmacist, an anticoagulation program, geriatrics program, amongst others.
My name is Crystal Deep, and I am the PGY1 and PGY2 Residency Program Coordinator. At Valley Medical Center, we believe in better health for all. As a pharmacy department, we're always looking into ways that we can improve for our patients, ways that we can further change how we are currently going about our policies and our procedures, or looking into ways how we can add to things to better improve patient outcomes.
We are a larger residency class, and we've grown a lot over the past few years. We've invested a lot in this residency program in creating these positions for residents because we see the value in what they do. They're able to be large contributors to the healthcare team. They work on various projects for quality improvement. They're involved in those pharmacy and therapeutic committees to advance medication initiatives. And I would say above all, the leadership team here really cares about the residents and wants to see them grow both personally and professionally.
Our preceptors really care here. Majority of them have been residency trained, so they know where all our residents are coming from and how they're feeling on day one as they transition from student to resident. And so that transition can be a little scary, but our preceptors are there to assist them all the way, to provide the support they need as they learn the ins and outs of our enterprise system and move forward as an independent pharmacist.
People here are amazing, and I think that's one of the things when you look for a residency you might not think about on the top of your head. You think about the training, you think about the type of experiences you're going to have, but you might not be able to actually think about the importance of the people you work with. And for me, I think that was the biggest determining factor in deciding that I wanted to be here, is because no matter where I've stepped into, everyone has always been so welcoming, and I think that's really impressive for an institution as large as our own. We have so many different service lines, and it doesn't matter what team I step on, they always make me feel included and a part of that team.
It's one of the busiest ERs in the state, and we get a wide range of patients, including burn patients, trauma patients with the highest acuity. Being able to attend and participate in this interdisciplinary care of patient care and resuscitation has just been something that I've really dreamed of, and I feel very fortunate to be able to be here.
Residency is definitely a difficult time. You have a lot of things to learn, you have a lot of projects to work on, and those are things that are expected out of a PGY1 residency. That still doesn't stop life from happening, and what's really great about this program is that your RPC, the Residency Program Coordinator, as well as the Director, have been so willing to hear out what's going on in your life, so that way they can adjust your schedule or what's happening during your residency year to fit what's going on. And I feel that that's important to me in a PGY1 residency, having that connection with the people that are meant to look out for you.
I always tell people I'm living the dream here. I've been able to pursue everything I wanted to, got to help all the patients I've wanted to, and I'm really thoroughly enjoying it here. I think what drew me in most was the fact that they had really strong ambulatory care experiences, teaching experiences, and we helped the underprivileged community. My parents, when they first moved here, they didn't have access to a lot of services, so it's my way of giving back for the services that they did receive from like county health systems and from other public services. Like, it's just been one of the most rewarding experiences because we've been able to serve patients that, you know, are super underprivileged, may not even have access to like a roof over their head. So it's been really rewarding seeing these patients over time really progress in their disease state management. We have a lot of diabetes patients who are improving, a lot of hepatitis C patients who are being cured, and a lot of that just has to do with being able to follow up with them consistently.
Over the years, I've seen a lot of patients where there's a lot of gap in access to medications. And just even for example, just last week, I noticed a patient that I was talking to was getting medications that were expired because she wasn't really sure how to circumvent the situation and get medications on time. So even these little things that maybe patients aren't aware about in terms of medications and whatnot, I'm just honestly proud and so honored to be able to help bridge that access for patients in their time of need.
On top of all the clinical knowledge that we're learning here, the group of administrators and preceptors that we have here have really taught us just a lot of life lessons outside of the clinical aspect of residency.
We have such a strong support system, and the PGY2s kind of look after us and mentor us as well. And I think that's a very important aspect in choosing a residency too, is making sure you have the right people in your corner as well.
What is very unique about our residency program as well is the fact that we have a really big number of residents compared to other sites. Usually most sites have an average about 2 to 4 residents per year per program. But for ours, it can range up to potentially 16 residents, including PGY2s, in which you have a greater camaraderie. We have this type of bond that is indistinguishable from other places.
I want to thank you for considering Santa Clara Valley Medical Center as your destination for learning. Healthcare is just not about the hands-on provision of care to an individual, but it's everything else that comes with it. And here at Valley Medical Center, I think you'll get the opportunity to learn not only direct patient care, but also learn about how we as a healthcare system serve the much larger community, which I think will provide for a really unparalleled experience.